Well, welcome back. More Americans are currently abusing prescription drugs than those who are abusing cocaine, hallucinogens, and heroin combined. And a common concern among parents is the increased numbers of teens who are abusing and misusing the medications. Now, joining us this morning to talk about this frightening trend is Dr. Emily Rae-Stuart. Good morning, Dr. Rae-Stuart.
Good morning.
Can you first off just tell me what is the prevalence of misusing and abusing among teens?
Well, it's surprisingly high. In 2008, a study found that 10% of high school seniors had abused Vicodin in the past year, and 5% had abused OxyContin. So 1 in 10 or 1 in 20, that's fairly high.
And what are some of the warning signs that you can see if your teen is abusing these drugs?
Well, I think you have to look at a number of things. I think most importantly, you have to just pay attention to your kids and pay attention to what they're doing. If you see any drastic changes in behavior, such as sleepiness or lack of need for sleep, irritability, depression, if you see that they're being more secretive, there's money unaccounted for, grades are dropping, those would all be reasons to become aware that something's going on.
And if a parent does see those signs, how can they go about, talking to their child or their teenager about prescription abuse?
Well, ideally they talk to their kids before it ever happened. When parents are talking about alcohol and other drugs like marijuana, they should also talk about prescription drugs and how those can be dangerous. If parents suspect, I would recommend talking to their kids in a non-confrontational way. Just have a conversation about it and see what they say.
And how should they parents store these prescriptions in their home so kids can't get to them at all?
Well, obviously, locking them up is the most foolproof way. Although, teens are pretty smart, they can get into locked doors. So it's good to just keep track of how many are in the bottle, get rid of any you're not using anymore.
All right, and thank you so much for joining us this morning, Doctor.
Thank you.